Hello, everyone. Dr. Shannon Clark here. I'm waiting for our guest to arrive. We're going to be discussing navigating the trauma and grief of infertility. So I'm going to wait for her to join us. A few more minutes. There she is. Let me see. Go over here. Okay, here she comes.
Hi.
Hi there. I'm so glad we got to do this. I'm so
Me
excited.
too. Me too.
I'll just let you guys in a little secret. There's a ticking time bomb on labor and delivery, and I'm back up today. So I had messaged Dr. Johnson a little while ago, said I'm not sure what's going to happen, but we have a little bit of time, so we're going to get this in. I'm so excited.
Yes, me too. Me too. You are
Oh,
such a trooper. So, I mean, if
yeah,
you're
I did. Listen, we just got to get through the hour, and then I can hit the road. That's all
there
I
you
got to
go.
do.
There you go.
Okay. Well, I'm Dr. Shannon Clark with Babies After 35, and I'm introducing here Dr. Lori Johnson. She is a licensed marriage and family therapist with more than 25 years of experience as a clinician, educator, and clinical supervisor. She also does she's an online psychotherapist and therapeutic coach, and you're based in Los Angeles, right?
Yes, I am.
But so I always ask, if you're based in Los Angeles, does it mean you can only see patients that are in California, or can you do other states as well?
That's a great question. Right now, I'm only licensed to do psychotherapy in California, but
Okay.
I do kind of provide therapeutic coaching, which I'm sure we'll talk about in a little bit,
Yes, yes.
for people outside of the state.
California.
Hmm.
Gotcha. Okay. And then you also specialize in women's mental health, reproductive health, and you also do couples therapy for those that have been through infertility trauma. And we'll talk more about that.
Yes.
So I'm very excited to have you on. Anybody that knows my platform knows that I've been talking a lot about birth trauma and PMADs, or perinatal mood and anxiety disorders. Another thing is infertility trauma, which is not often discussed. Why am I interested in it? Because I've been through it. I've done it. I've been through it. I know what it's like.
Hmm.
And most of you know my personal story. I'll just be brief, but then I want to hear Dr. Johnson's story. But for me, sorry, that was my dog's shoes in my lap. For me, after almost 2 years of infertility treatments, then 2 months of hospital bed rest, premature babies, twins in the NICU for 6 weeks. I didn't realize until they were probably 2.5, 3 years old that I had some trauma. I was very good at pushing it away. I was an active physician. During the years I was going through infertility and bed rest and all that, I was promoted to professor. So I got all that done. So it was probably a way of probably pushing those feelings
Hmm.
aside. So now that all that's done, now I'm like, okay, something's going on here. So I realized that I do have some unresolved issues regarding that experience I went through. So tell me about yours. I
Yeah.
stalked you a little bit on your website, and I understand that you have your own story. So talk about it.
Yes,
Yeah.
yes. So, like you said, I'm a psychotherapist. I've been doing work in the community peripherally for about the infertility community, and specifically for almost 10 years. But it wasn't until I started going through my own fertility
Mm-hmm.
issues that, of course, my perspective shifted. I was one of those like you. I got married later in life. Can't control when you meet
Yeah.
your
Yeah.
partner.
Mm-hmm.
Naively thought that I wouldn't have issues conceiving. And so unfortunately, what happened about 6 months after we got married, I got pregnant,
Mm-hmm.
had a miscarriage,
Mm-hmm.
went through that process actually of miscarrying naturally,
Mm.
and didn't really realize just the weight of that experience, because
Yeah.
it wasn't just like a missed period, or excuse me, having a
Yeah.
period and just going
Yeah.
through the process of
Yeah.
that, and then decided to kind of wait a little bit. I had fibroid issues, had those taken out, and then got pregnant again. And that's where we discovered there was something wrong with our son in the second trimester.
Mm.
So I went through
Mm-hmm.
a very traumatic loss. Then didn't really have time to grieve that loss
Yeah.
because of my age, went straight to IVF,
Mm-hmm.
did that for a year and a half.
Yeah.
And that yielded a chemical pregnancy. And then
Mm-hmm.
I had a miracle pregnancy after 2 months after that. And so
Okay.
my body, that was all within the
Mm-hmm.
span of about 3 years.
Yeah.
And so I'm sitting there going through all of this, like, I'm on this, this train, this fertility journey to this path to parenthood. I'm also a therapist, so I felt like I should have recognized the signs of
Yes.
trauma. And it wasn't until I was kind of through it a little bit that I realized, and my own therapist was just like, yeah, of
Mm-hmm.
course, because
Mm-hmm.
you can't really deal with it. It's hard to deal with it when you're in it, and
Yes.
you're just concentrating on getting to the
Mm-hmm.
next goal.
Yeah.
So
Mm-hmm.
that was a little bit of my history. My husband and I decided to take a break from treatments for a couple of years, and actually just resumed not too long ago. So
Okay.
we're kind of
Yeah.
back in it
Yeah, yeah.
after the
So,
fact.
I mean, listen, your story sounds very similar to mine, and probably sounds very similar to a lot of people who are listening.
Hmm.
And I think that we don't understand, even when we're going through it, with just the physical act of going through the infertility treatments, the physical act of loss,
Right.
all the physical stuff we get, but we don't think about the psychological and emotional impact. And even as we progress along, and even you had a miracle baby when you weren't expecting it, and that doesn't cure everything. I think
Mm-mm.
one of the common misconceptions or thoughts is that, well, you got a baby, you should be okay. And we even do that to ourselves. Well, I have my twins. Why am I having an issue?
Right.
And I think it's hard. Go ahead.
I actually probably misspoke. I had a miracle pregnancy that also
Yep.
ended in
Oh,
another loss. So
oh, okay.
no,
Yeah.
no,
I
no,
didn't know that. Yeah.
no miracle baby
Okay.
yet. But
Okay.
I,
Okay.
but I, but I think what you're saying
Yeah.
is true.
Yeah. Yeah.
Even when you do have your child after the fact, it doesn't take away from the
Okay.
experience of.
Yeah. Yes. Right.
Mm-hmm,
So, okay, so let's talk about the infertility trauma specifically.
mm-hmm,
So, one of the stats that I got was that according to the CDC, or Centers for Disease Control and Prevention, in the US, 6.7 million women between the ages of 15 and 55 experience problems getting pregnant or carrying a pregnancy to term. So, that's more than 10% of women
mm-hmm,
in that age group. And so the chances are, and we all know this, that
mm-hmm,
you or someone you know has been through it.
mm-hmm.
And we are very familiar about all the biological causes, that can cause infertility, PCOS, fibroids, all the biological causes. But what
Mm-hmm.
we don't talk so much about is the psychological and emotional component of
Right.
infertility.
Right.
So talk about some of those components that might indicate or let someone know that they're having infertility trauma.
That's a great point, because I feel like the mental health field is actually evolving, and we're finally
Mm,
labeling infertility trauma for what it is. We do know that the longer that people are in treatments, that the higher level of anxiety and depression that they will experience. Now, some signs of trauma might look like, just this sense of heightened anxiety around
mm,
appointments, fertility, these obsessive thoughts that people might have about
mm.
where they are in their fertility process. It could mean also this avoidance of, sorry, now my dog is
It's
heavy.
okay. I understand. It's okay.
Sorry. Um, and so some other signs that Amori, it's okay.
It's
It's
okay.
okay. It's okay, sweetie pie. Did you want to say hello to everybody? Sorry,
Hi.
my
Oh.
my husband just came home, and so she has to make herself known. So I
Yes, yeah,
apologize, you guys.
that's okay. Hey, we're good with dogs.
Yes. So what we also see is a sense of irritability, trouble
Mm,
sleeping.
mhm,
There might be intense feelings of sadness,
yeah.
guilt, shame is
Mhm,
another one. Difficulty concentrating.
mhm,
Also, just variations in energy. So, might be feeling
yeah.
really drained and exhausted.
Mhm,
Also, another sign that people might look for is just feeling kind of numbed out.
mhm,
So they just might not have their feelings might not be registering.
yeah.
They might not be feeling really happy or sad, or
Yeah.
just kind of neutral.
Yeah.
And so that, coupled with some avoidant behaviors that we might notice in terms of how people deal with their triggers,
Mhm,
is basically how we start to think about trauma.
mhm,
And then when you think about how perceived their experience or emotional experience might have been of certain procedures, doctor's appointments, and
mhm.
all of that, that's where the individual perspective, I think, really comes into account in terms of how we diagnose it too.
Yeah, yeah, yeah.
Mm-hmm.
So, and I know exactly what you're talking about. I mean, I think we kind of probably all expect it, or we might say, oh, it's just because of the hormones, or it's
Right,
just because of this, and we
right,
write it off.
right,
And I have to be honest, and unless you have someone that's kind of on the outside looking in, it's going to be
right.
hard for anyone to make that distinction. This is
Exactly.
typical, or this is beyond typical, and I'm starting to cross over into where I'm starting to have some emotional and psychological consequences of my
Right.
infertility journey. So one thing, and I'm just going to say it, is
Mm-hmm.
earlier on,
Mm-hmm.
one of the things I think, and looking back on what I went through, I really think that having a therapist at the beginning of an infertility journey, especially when you're going through treatments and that, should be kind of mandatory.
Yeah.
Because then you have that person that's kind of walking you through it, and they can pick up on things. I wish I had. When people ask me what's the one thing I wish I'd done, I wish I'd done that. I
Right.
wish I had from the get-go had someone that I was talking to throughout my journey, to help me through that, because I think it would have changed a lot of things and how I was able to, and give me better coping skills on how to navigate through those years. What do you think?
Absolutely. I,
Yeah.
I completely agree. And I think just even being in the field, I have an interesting perspective as well,
Oh.
because, the expectation is that we are in therapy, and I
Mm-hmm.
was in therapy off and on. And even I had trouble
Yeah.
finding somebody to really hold space for me around
Yeah.
that. And it wasn't until probably a few years into my journey that I found a support group that was actually led by another therapist that was really helpful. And not that my individual therapist wasn't a good therapist at that point, but she just didn't have the knowledge around the fertility
Gotcha.
information. And
Mm-hmm.
so what happens sometimes is people don't want to have to explain what it's like
Yeah.
to go through all the
Yeah.
hormonal shifts and things like
Mm-hmm.
that. So
So what we're going to so right, so you could find a therapist that specializes in reproductive health or
mhm,
infertility trauma or something.
mhm,
But say you can't, and you said
mhm.
you found a support group. What
Yeah.
other kinds of support are there? Support groups? What other things can people look for in order to find support? Because it doesn't have to be one-on-one therapy. There's other
Yeah.
ways to get support. So what would you recommend looking for?
No, so I think there's a wonderful network on social media that
Mm-hmm.
it has, I think, really exploded.
Mm-hmm.
And we talk about the downsides of social media, but I think the beauty
Yeah.
of Instagram and
Yeah.
Facebook communities is that it's really joined people together,
Mm-hmm.
and across just time zones and states and things like that too, so people can connect to other people and have a sense of community, because that's really what's important too, is having a sense of community of people who get what you're going through, who aren't judging. And so I think there are lots of different kind of programs that are offered by
Yeah.
various coaches and counselors in the field that provide, I think, very different needs.
Yeah.
Some people might need a little bit more support around nutrition. Some people might need more support around their emotional well-being. I've seen some great yoga programs for
Yeah.
people. So I think it's not one size fits all. I think it's really
Mm-hmm.
what's
Yeah.
speaking to you in that
Yeah.
moment,
Yeah.
and asking and answering what you need.
And it's okay to try different things.
It is.
If you've never been through it, you're not going to know what works for you. And
Exactly.
you may need to try different various modes of support or therapy to see which one works for you. And that's fine too. And while, I also want to add in too, that it's not just the person going through the physical infertility journey, it's the partner,
Right.
the support person, whoever's going through it with you, that may need some support as well.
Exactly.
So talk about that. How
Yeah.
do you think it's important that they do if it's a couple, therapy together, individually, or what recommendations do you have regarding a partner?
I think it can be a variation of both. What I end up seeing is normally it's the gals that are reaching out. Sometimes their male partners are a little bit more reluctant to seek help, and that's not uncommon. It can be frustrating, but when you start out on this journey, you think, okay, when you're going through treatments, only your fertility is going to be impacted. You don't think
Yeah.
about the other ways, your
Yeah.
relationship with
Yes.
friends, your partner, and things like that. And so I love it when I get calls from couples saying, you know what, we're about to start treatment, or we're already in treatment. We just need to make sure that we have a place to land and connect. Because it's really important to make sure that you have that community support for your relationship, just like we get it individually for our journeys. Our partners need that too. And also learning that our partners cope differently than we do.
Yes.
And whether it's how you're navigating treatments or whether you're navigating a really complicated grief journey like my husband and I did.
Yes.
And realizing that just because your partner may not express themselves the same way that you do doesn't mean that they care any less, or that they don't want the same outcome in the same way that you do.
Well, I think we underestimate the emotional and psychological impact it has on our partners.
Mm-hmm.
That needs to be addressed,
Yes.
and we need to realize that they go through it too. They may not be going through the physical part, or maybe not to the degree that we did,
Right.
but they still go through it. But also, they could learn ways to better support us.
Right.
And getting those. I know my husband didn't know what. He didn't know what to do. He'd never been through that, and I can only. He's like, "What do you need?" I'm like, "I don't know."
Yeah.
I didn't know, and I'm like, I wish I could tell you what I need. I really don't know. So it's there's so many levels where you can get supported to make the journey. What's the right? It's not going to make it easier, because infertility journey is not easy. but
Right.
finding better ways to cope and manage to where your job, your relationship, your friendships are not as impacted. That's kind of how I see
Right.
it. It's better, like
Yes.
more like getting coping mechanisms to help you be able to go to that next step and that next step, right? While
Right.
preserving what's around you.
Preserving what's around you. And that's where
Yeah.
having boundaries
Yeah.
are so important. You need space where you're not always talking about fertility related or grief related
Yes.
stuff. And
Mm.
otherwise, it just can feel like it takes over. And
Yeah.
when so much of that heaviness and negativity just seeps into every aspect of your relationship,
Mm.
or relationships with friends, then it becomes overwhelming. And that's when people get more isolated and upset too.
Yeah.
So having those boundaries is important.
So, we've talked a lot about, the different types of therapy and some of the
Hmm.
signs. And, when we hear, and I'll just use birth trauma as an
Hmm.
example. I did
Hmm.
a discussion about birth trauma, and people automatically thought I meant you had a birth, you were injured, or baby was injured. Trauma meaning physical. And
Oh.
that's not what I meant. I meant
Hmm.
birth trauma meaning you might have had birth trauma related to your birth experience to where things didn't turn out the way, or you had a complication. For me, I
Hmm.
had an emergency C-section and blood loss, and that was traumatic. And not that anything was physically done to me negatively. It's just
Hmm.
that it was a traumatic delivery, and my
Yes.
babies are fine. So, the same thing can be said for infertility. We're not talking about just the physical, like there was something traumatic that physically happened to you. We're talking about what happens here and here as well. So
Yes.
that's important to understand it. So infertility trauma, does that kind of correlate a little bit? Because for birth trauma, it does with
Hmm.
PTSD.
Yes, it's the lived experience. I mean, so that's why we
Yeah.
have certain, we might have certain signs that we look for that indicate, okay, these are like trauma reactions, but we're also
Mm.
listening to the quality of the experience of the
Mm.
person. And that's where it's so individualized
Mm-hmm.
because some people can go through infertility stress, and there is a difference between stress and
Yeah.
trauma, and it can resolve on its own. But for the people who don't, this is where I'm listening for, okay, how long have you been dealing with this?
Mm.
What's the intensity around this? What are the ways that, and I kind of look at things in terms of scales and,
Yeah.
and kind of helping people really characterize on that scale how intense or bad it feels for them, because it's that lived experience. And so
Yeah.
if there's an experience of felt trauma there, then that's how I deal with it.
Mm-hmm.
And that's why, we kind of help them process and develop coping strategies, but, kind of work through that in a healthier way.
So what are some of the things you look for? You mentioned a few, but like if you
Hmm.
have someone that's coming to you and there is infertility stress. I think when I started out, I had
Yeah.
infertility stress, but then it
Right.
crossed that bridge at some point into probably traumatic and more of a
Hmm.
PTSD
Hmm.
experience.
Hmm.
Um, what can you do? Like, what are you looking for specifically? How do you, I don't know if it's so much of the diagnosis, but and how does the treatment or the therapy shift from treating a stressful situation versus someone that's crossing over into a more traumatic situation? Am I making sense?
Yes, you are,
Okay.
because I think that's still a nuance that
Okay.
we don't talk a lot about, and one that I think the field is still continuing to define.
Okay.
But for me, where I see the difference is really around time and, is anything resolving? Meaning, and what are their triggers? Number one, what is their experience of the triggers, and then that level of intensity? Because if it's not necessarily resolving, and we might hear that around. Help people, this level of anxiety that they experience when they're going to doctor's appointments or
Yeah.
treatments. And so that's when I might shift into much more of my kind of trauma kind of techniques, because I do EMDR, which is
We're
a
going to talk
trauma
about that.
kind of
Yeah.
therapy. Yeah.
Mm-hmm.
Which is really about helping the body, utilize whatever, or kind of maximize their emotional resources and create some external ones where they might not have them internally. And so I see some people that are actually on the verge of kind of panic. So there is this kind of
Yeah.
hypervigilance
Yeah.
around the
Yeah.
anxiety, where, that's the spectrum that I'm looking at. Like,
Yeah.
are they constantly registering at a 10, like feeling they're
Yeah.
about to come out of their skin? To me,
Yeah.
that's a heightened stress response over
Mm.
a long period of time. To me, communicates trauma, versus someone who's like, okay, this is uncomfortable and this is stressful. I'm managing. I don't like it, but I'm managing. And they might just
Mm.
register like a 4, a 3,
Yeah.
or a 4
Okay.
on the
Gotcha.
scale.
Have you ever had patients who got on the other side? They were
Hmm.
able to bring home a child, but they still have infertility trauma.
Yes. Yes.
So
Because,
what does that look like?
well, it looks like, it's a very, it's so interesting because I've seen it happen for so many different people. And I think they know going into the birth that that they've heard enough stories that it's, they realize that it's not necessarily going to change, and they're really excited about welcoming their child. And then there's also this moment where, and it hits differently for different people, and it's hard to kind of figure out why or when, but it's that, that remembrance of, oh, this is really hard, and it's kind of jarring. And so the work does shift around that too, around holding that space for being able to enjoy their babies, but also, okay, let's actively work on your experience of that, and also help your body heal from that as much as possible.
Yeah, I think looking back, how I know that I had trauma is that once I got pregnant, I was on hospital bed rest for complications, but I didn't bond with them. I didn't bond with them until shortly before I delivered, because I was afraid to.
Yes.
And I think that was that overwhelming cloud of the infertility that was still in the back of my mind saying, it could still go wrong. And it probably will go wrong. And I just, that's probably my biggest regret. I feel like had I maybe gone through some treatment during that time, that I would have been able to bond with them more in pregnancy. You know what I mean? And listen, I beat myself up over it. So I'm being honest with you, I do.
Yeah.
But I understand why I do.
Right.
But I also understand why I felt that way. And I know it doesn't make me a bad mom. It doesn't mean I love them any less. But looking back, I see that now. Does that make sense?
It totally makes sense. And the way that I try to frame that for my clients when they, because I see that sense of fear, and that's a coping strategy in and of itself, that in some ways I don't want to pathologize, because I feel like that's your body's way of trying to get through the unimaginable. And so if there's a little bit of distance that you had to create for that, that's what you did. And, so intellectually we get it, but I know that emotionally it's still hard to kind of reconcile. So but
I think it was a coping mechanism, but I think I think the reason why I'm bringing this up is that I want people to understand that even if you get on the other side, you still might have some trauma related to your infertility journey that might still need to be addressed.
Yes.
And that's okay. And if anyone's telling you shouldn't be feeling that way because you have your take-home baby and you should be over it, that's not right. It's not easily, infertility trauma and is not fixed with a take-home baby.
Not at all. Not at all.
It's not. And I know that now. I do know, and I understand it. So that's what I want to say. If you're still feeling that way and you had a take-home baby, it happens, and you can still get treatment for that and get therapy for that and get on the other side of it so that you can find ways to cope with it and reconcile it so that you can move on. Right?
Absolutely. Absolutely. And don't judge yourself, because it might, you might not notice it right away either, because I do see women, probably 2 years postpartum who are just kind of like, oh my gosh, now I'm it just hit me. And you can have the best of intentions of trying to be, and trying to tend to your mental health, and still, not be able to kind of grasp needing to do the work. So, being gentle with yourself around that.
Yeah, I agree. Okay. So talk about, you deal with, you treat infertility trauma and grief. That's your thing. And I understand why. I don't want to talk specifically about EMDR yet. I want to save that for that. But what are some of the services you provide, and, or that people can get from someone like yourself who does infertility trauma work?
Yeah.
Well, what can you do?
So sometimes what I do, there are a couple of services that I provide. Obviously, just straight kind of individual talk therapy outside of the EMDR kind of approach. For my infertility clients in particular who are going through specific treatments, I do what I call therapeutic coaching, which is really designed to make sure that they have specific coping strategies that are designed for each stage of the journey. Because obviously when you're going through the prep and the stim, you have very different needs. Your body has very different needs emotionally than when you're going through, kind of when you get to retrieval, and then when you kind of prepare for transfer. So in some ways it's really about kind of designing or thinking about, okay, what specifically are the needs there, and filling in the gaps and addressing them in a personalized way, because there's no size fits all for people in terms of, how their body's going to respond to the techniques and what they find helpful. So that is one service that I offer. And then obviously like the psychotherapy, and then the EMDR work, and also my couples work. So
you're one of the people that someone who's starting their infertility journey or infertility treatments can go to for the therapeutic coaching throughout
Yes.
Right. So
Yes.
how, if someone's in, you're in California, if someone's in another state, how can they find someone like you? What is it that they Google? What do they look for to find someone that does what you do?
So I'm a little bit different because I am a therapist who does
Okay.
fertility coaching,
Okay.
but sometimes people will find me because they're Googling fertility coaching.
Gotcha.
And I think that's probably the most common term that people look for. Um,
Fertility coaching or infertility coaching?
excuse me, infertility coaching.
Infertility. Okay.
Yes,
Infertility. Okay.
yes, yes. So that's how they would kind of find me because I do
Okay.
that. But I think what makes me a little bit different is because of my training as a
Yeah.
therapist, and
Yeah.
and I do let people know if I kind of think they're appropriate for coaching versus
Mm.
whether or not they might need to, kind of slide on over for some
Yeah. Yeah.
psychotherapeutic work, and then connect them with somebody in their area.
Okay. So talk about that. If
Yeah.
you have someone that comes, what's the difference? What would make someone not necessarily be a good candidate for therapeutic coaching? They might need to go into psychotherapy, and then talk about what psychotherapy entails.
Right. So psychotherapy, I think, really goes a little bit deeper into some of the stress response reactions
Mm-hmm.
that they're having, because there's a way that coaching can be therapeutic, but not necessarily be therapy.
Mm.
And so sometimes what I see in terms of a good candidate for therapeutic coaching is, someone who has a clear plan. They have a good relationship with their medical doctor. They are, we don't see any kind of severe symptoms of anxiety and
Mm.
depression. Those are some things that I also look for, because if there are heightened levels of anxiety or heightened levels of depression, again,
Mm-hmm.
looking for intensity and time,
Yeah. Mm-hmm.
then I might say, what, this isn't appropriate for you. Therapy makes more sense, just
Mm-hmm.
because when, my techniques kind of shift, like I said, in terms of how we look at resourcing and how we monitor it as well. How those interventions are working for the individual. So I do find that the majority of people that are kind of coming to me though for coaching, it makes sense for them. They've kind of gone through maybe a round or two, but know that they need a little bit more support, and they respond quite well to that.
Okay.
But yeah, so it's again, I keep going back to, it's really intensity and time. So how intense are the feelings and how long have they been dealing with it? Because that tells me, all right, this is a good candidate for coaching versus not. And it's hard to say whether or not, if someone's been doing this for 6 months or a year or 2 years, whether or not they meet, they fall into one category or the other, because again, that individual experience also makes a difference in terms of how, of how I kind of diagnose, or how we kind of,
Gotcha.
yeah,
Gotcha. And then
yeah.
what are some of the techniques or some of the things you do with psychotherapy that's a little bit different?
So the techniques that I do, and I talk so much about EMDR
Okay,
because that's just what I
we'll
do.
talk. Is this
Yeah.
is this a good time to do it?
It's a good time to do
Good.
it
Go
because
for it.
I
Yeah.
do.
Yeah.
We talk a lot about resource development in terms
Okay.
of preparing people for
Okay.
trauma. And EMDR stands for eye movement desensitization and reprocessing.
Okay.
And it's been, I think, kind of in the field for probably the past 30 years. And
Okay.
we learned a lot by working with like people who've gone off to war. And,
Mm.
so we've really kind of had a sense at looking at this model for people who've experienced trauma in the kind of most familiar sense.
Gotcha.
And so what we start to look at is developing resources. And so emotional resources are coping strategies kind of on steroids, so to
Mm.
speak. So it goes a little bit beyond breath work, which I think is important. Don't get me wrong. Being mindful of how your body experiences stress. One of the things that I think is important, we pay attention to how the body is experiencing it. And we also
Mm.
believe that the brain and the body has its own way of kind of healing. So we're kind of
Mm-hmm.
working with that as well. So when I
Mm-hmm.
think about resources, it might be kind of figures, helping them think about people or supportive figures in ways that are meaningful to people. But then we also use what's called bilateral stimulation, which is
Mm-hmm.
kind of tapping or using eye movements to help deepen that. And there's this idea that we can help the body reprocess difficult feelings, difficult thoughts, and kind of promote its own healing through this bilateral stimulation that we kind of create.
Mm-hmm.
So that's what I start to kind of veer into a little bit with the therapeutic kind of model, which I don't necessarily do with my coaching clients. That
Okay.
is different.
Mm-hmm.
Excuse me.
That's good. Yeah. Okay. And so, who would be a good candidate for EMDR?
I think I mean, the majority of people are great candidates
Okay.
for EMDR. I think it's really sometimes a little bit more efficient than
Mm.
traditional psychotherapy,
Okay.
because it doesn't necessarily involve people needing to even tell their entire traumatic story.
Hmm.
We're looking at what are their experiences, just their overall memories, and having them work with that. And then when we start to kind of bring in some of the stimulation, it just allows, we just kind of say, let your mind go with that, and kind of monitor to, how that kind of goes. I know I'm not necessarily, might not be explaining it the best
Yeah.
way, but it's a little
Yeah.
different. It's a little
Yeah.
different, but I
Yeah.
think it's really exciting and
So
effective.
does this need to be done in person, or can you do it virtually?
I've been doing it virtually
Oh,
since the pandemic. It was actually
okay.
something we were a little concerned about, but you know, doing it, but the data actually shows that it's just
Hmm.
as effective
Okay.
as doing it, virtually than it is, just in the office.
And do you think there's any particular reason why those that have been through infertility trauma, in your experience, respond well to EMDR? Is there something about that type of trauma that makes them more responsive?
That's a great question. Because I think there are just multiple kind of trauma modalities out there.
Mm,
What I think that is so important and why EMDR speaks to people is because it talks about the lived experience.
mm,
It's kind of like that mind body connection, but also from a neuro kind of science,
mm,
perspective,
mm,
where
mm.
we recognize that connection, and we know the ways in which that kind of starts to come out kind of physically. And so we kind of like pay attention to that. We kind of help people process and build skills around it so they can tolerate the distress,
Mm.
without any adverse effects.
Hmm.
So
That's interesting.
yeah.
I might need a little. No, I'm serious. I'm serious. It just sounds very interesting. I actually heard about EMDR from a television show. I forget what it was called.
Hmm.
Way back when, and that was the first time I'd ever heard about it. And
Hmm.
until now, I haven't really learned that much about it. But I'm gonna look into
And
that.
a
Yeah.
little history about it too, because
Yeah.
I was actually really skeptical about it.
Okay.
I've been in the field for a long, long time. I remember when Dr. Francine Shapiro was probably, I think it was probably about 10 years into developing this model. And so even at the time, like 20 something years ago,
Mm.
we were all a little bit skeptical about it.
Okay.
And I was new in my career. And then of course, I think just, you have a new model that comes on onto
Yeah.
the stage, and you're just like, wait, what is this?
Hmm.
And then it wasn't until years later, where after I went through my own experience and I kept hearing about it, and then I finally decided to, kind of try it. And I'm like, oh my gosh, so I've
Mm.
actually, done it and then decided to get trained in it because
Mm.
it was so life changing in terms of just, ways in which it shifted things that talk therapy didn't really get to. And that's the
Okay.
thing too, because sometimes there are ways in which memories and feelings and experiences are just locked in our bodies
Hmm.
that we can't fully put words to. And so
Yeah. Yeah.
sometimes even with EMDR, if people are coming to me with feeling, or excuse me, just ideas, or just, I'm just stuck and I don't know, they don't necessarily have all of the words. EMDR can still be really effective because we're
Mm.
like, okay, just let's go with the sensations. Let's just talk
Mm.
about sensations. So you don't even have to have all of the language to even fully process it, which I think is interesting.
That is interesting.
Mm-hmm.
Huh, that is very. We might have to do a whole other session on a discussion on EMDR, because now you've intrigued me with this. So pretty cool. Okay, so I wanted to, before I answer questions, do have one other question for you.
Mm-hmm.
And then we'll go through the questions that came through.
Okay.
Like I said before, I do think getting therapy and or coaching throughout this process, infertility, whether you're going through treatments or not, you might just be going through infertility and you haven't started treatments, or you're going through the treatments and you're in the middle of it. Um, it's very important. But what I also think is extremely important is that you understand the credentials of who you're going
Yeah.
to.
Yes.
Because, and like you said, I agree that social media is great for support groups, and you can find some really good support groups. And a support group is different than someone that you're seeking for individual therapy
Right.
or counseling, right?
Right.
And as I'm saying this, if I say something wrong, just interrupt me and tell me. So
Mm-hmm.
there's support groups which I think you can get on social media and are great, and you can go into that support group, and you might find it's for you, it's not for you, because you'll kind of learn the pace and what the support group is like once you get in.
Mm-hmm.
And it might take you a few support groups to find the one that's for you, versus seeking someone like Dr. Lori Johnson, who does therapy and is licensed, and then versus a coach. How do you tell people, how do they vet who they're going to? What can they look for? How do they find out what someone's credentials are? And the reason why I'm saying this
Mm-hmm.
is there, and it's unfortunate, but there is a huge thing on social media right now with people who are offering services for anything and they have no credentials.
Right.
And they're very good about the, and they
Right.
can read that and regurgitate it. But if they have not been through the training, they should not be counseling anybody.
Right.
And it
Absolutely.
happens. You know what I'm talking about.
Yes,
It
I
happens.
do.
So
Yeah.
tell
Yeah.
everybody, how do you vet?
Yes, that's a
Yes.
great question. So I think most importantly, I think you should ask
Mm-hmm.
because the majority of people that are doing fertility or infertility coaching are people who've just been through it themselves.
Mm-hmm.
And there's nothing wrong with that. You know, again, there's nothing wrong with that. You might need that touchstone to tell, somebody to help you understand what to expect. But when it comes to kind of dealing with the emotional fallout
Mm-hmm.
of what the experience means, handling anxiety and depression, this is where I start to see people operating in gray areas that make me
Yeah.
uncomfortable.
Yes.
So I think, when you start to notice that someone's giving you more emotional advice that feels therapeutic, I mean, being very clear or asking them what are their qualifications around
Yeah.
that? What is their training?
Mm-hmm.
Because I have clients asking me that all the time, and I'm
Yeah.
like, and I can definitely give you,
Mm-hmm.
you can even look up my license number. I
Yeah.
mean, I can tell you all
Mm-hmm.
the, just the extent of my training. And the other piece that I'm glad you're bringing this up about, because when I talked about support groups earlier, and this was something that was actually very, I just happened to luck out in having a group that, finding a group on Resolve that was, and I'm sure you all know Resolve, the
Yeah. Yeah.
National Infertility
Mm-hmm.
Organization, who happened to be led by a therapist, which was helpful because the other thing that I'm seeing that I experienced and also I've heard people describe is that when they're in these support groups, what starts to happen is these groups are they start to become really overwhelming,
Mm-hmm.
and what that communicates to me is there's not as much therapeutic control
Yeah.
over how the information is being unfolded, how is it being tended to, and if somebody stuff is taking up more of the group, then
Mm-hmm.
it's not necessarily leaving space for other people. There's
Yes.
actually a very specific skill set around running groups and group dynamics, and that's not my ministry. So
Yeah. Yeah.
there's so many therapists out there that do a great job of that. But, just even when you are walking into a support group, being mindful of, is it peer led? Meaning it's just
Yes.
somebody, yes,
So let's talk
versus,
about that.
yeah,
There's
yeah,
peer led, and then
hmm
there's someone who is actually a licensed therapist that can lead a support group. And
right,
for peer led, what I most think about is some of these Facebook's mom groups or support groups, right? That are not
right,
led by, they have admins and not, and I'm not saying that in a negative way, but
right.
they're peer led, meaning they may have been through it themselves, but it's a Facebook group or support group that people can go to versus someone that has credentials and they are a therapist and they do lead that support group, right? There's a
Exactly.
difference.
There's a
Okay.
difference. There's a difference because what you start to see in clinician led support
Mm,
groups is there are activities and there's structure
yes.
to help. And there's an attention to group dynamics that you don't see in peer led because
Yes. Yeah.
it's just not there.
Yeah.
But they're actually using the material to help people move forward, as
Yes.
opposed to we're just kind of talking about it and rehashing things in a
Yeah.
way that just I think keeps people more attached in their vulnerable kind of
Yeah.
space, and
Yeah.
they're not able to move forward through it.
Well, I'm glad we talked about this because I think it's
Hmm.
so, so important because there's so much out there and you have to make sure you know what you're getting into,
Hmm.
especially when it comes to your physical and emotional health, because you don't want to get into something that's not helping you.
Right.
And there are differences, and knowing what the credentials are of anybody that you're seeing, you can ask, show me where you went to school.
Exactly.
You can
Exactly.
ask, what is your license? There is nothing wrong with that.
Hmm.
And if anybody takes
Exactly.
offense to it, then maybe you should move along.
Exactly.
Right? I mean, no one who has credentials should ever take offense to someone asking, what are your credentials? What's your license number? They
Exactly.
shouldn't feel that way. So if you're
Mm-mm.
getting that response, then you might want to find somebody else. So I do think, especially for something like this, and because of what I see that's out there and people offering advice that don't have any real training,
Right.
it can be very damaging. And I just want to
Yes.
caution people, especially in this realm, for things like infertility and birth trauma, you have to make sure you know what the credentials are. right?
Exactly,
Yeah,
exactly.
yeah.
And I would be very, very concerned if you're seeing somebody who identifies themselves as a trauma specialist who has no mental health training whatsoever.
Mm-mm.
Because those are some things too. Like, does their title really match up with their qualifications? And so that's
So
another, yeah.
that's been another thing too, and there's
Hmm.
a lot of it going on. I know
Hmm.
there's been some psychologists who were doing something more specialized, but they had never had any training in that.
Hmm.
But why
Hmm.
were they putting that stuff? Because it got a lot of attention,
Yes,
and that's not right. You can't, and anybody can go find work and regurgitate it and put it on social media. You still have to vet those people.
you
You have to
do.
vet them.
You do.
You
And
do.
listen to how they talk about their training
Yes.
and their
Yeah.
experience. Like you said, if they're more defensive, just be kind of that just let that be a red flag. And if they
Yes.
just kind of let you know, hey, this is what it is.
And
Mhm.
yeah, and this is important now because of
Mhm.
COVID, and a lot of things
Yes.
are online.
Hmm.
So it's not like you can walk into an office and see their diplomas on the wall. You have to do more digging because a lot of people are doing this stuff online. So you
Hmm.
really have to do your due diligence to find out what those qualifications are. And that's
Definitely.
why I think this is becoming more of a problem because
Yeah.
more of this stuff is going on online,
True.
and it gives people a lot more freedom to present themselves as something that they're not.
Exactly.
Yeah.
Exactly.
So thank you. I mean, I didn't mean to actually, this wasn't on my list, but I'm glad we talked about it because
Yeah.
I think it's going to be very helpful. And and I'm going to actually carve this part out because people need to hear this.
Hmm.
And it's not just for what Dr. Lori and I are talking about, it's for anything, any kind of medical advice or whatever you're
Exactly.
getting. So it doesn't
Exactly.
just apply to this. Okay, let's go
Exactly.
through and answer some questions. Let's see. The way we license. Okay, but something about the way we license. So this is a comment, something about the way licensed mental health professionals are getting licensed across the country is contributing to the mental health crisis. What do you think she means by that? Or they mean by that?
That's an interesting thing. I'm not sure. I'm not sure. What I'm noticing though, that I feel like with what happened with COVID, and with everybody going online, what we were starting to see is some clinicians were practicing across lines,
Mm,
which actually was okay, which was sanctioned by our national organizations and boards because some people just needing to leave. And what's happened here in California is a lot of people might have left like LA, San
mm,
Francisco to move to go back home to be with family if we were going to kind of shelter in place for a while. But what we started to notice is that what did that mean for people's mental health care? And so I feel like with the Board of Psychology in particular, APA, that there was a little bit more leniency around that. But but I'm not quite sure because
mm,
it's not a hard and fast rule. We don't have reciprocity to practice
mm.
therapeutically across lines
Okay.
without getting permission from the new state's board.
Okay. Okay.
And each state, fortunately or unfortunately, kind of decides that, and
Yeah.
there's that own process. But
Yeah.
what I have noticed is that the mental health field is definitely really taxed, and I am hearing
Yes.
that people are not able to find clinicians.
Yeah.
Everyone's pretty busy, or
Yeah.
just really tired. So I'm not
Yeah.
sure.
That is true. That is true.
Yeah,
Okay.
yeah.
Yeah. I'm not sure either. Let's see what else we have. Mental health and reproductive health go hand in hand. More and
Hmm.
women's wellness centers should integrate both professionals in the same practice. And I agree. But
Hmm.
I, like Dr. Lori just said, and I see it just for our psychiatry services in general for my pregnant patients, there is a shortage. There's a shortage. And we
Yes.
need more people going into mental health professions, whether it be psychiatry, psychology, anything.
Hmm.
Um, we need more. And we've realized, and you can add to this, I've at least realized as a physician the deficit that we had because of COVID. And we
Yes.
realized just how much we need to put not only resources, time and effort, money being put into this.
Yeah.
We also need the physical bodies that are trained, right?
Yeah, we do. We
Yeah.
do. And as you can appreciate, have specialized training in this too,
Yeah.
because
Yes.
it's
Yeah.
it's still very different. Hmm.
Yeah. 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 Mm. Reproductive wellness and mental wellness are not separate from each other. Oh, wait. They are symbiotic and save both mom and baby years of trauma down the line. I agree. I mean, I
Hmm.
think and this is just for mental health in general, I still, despite our best efforts, Dr. Lori, there's still a stigma
There is.
about it,
Hmm.
especially in pregnancy. And I swear, if I hear someone tell a pregnant woman, you got to stop everything you're on because you're pregnant, I'm going to explode. Because
Yes.
they don't understand the consequences of that.
No, not at all.
And those of people that are taking care of reproductive age people who are capable of getting pregnant, that should be kept in mind before you start prescribing medications. Talk about family planning. What are their family planning goals? And adjust the
Absolutely.
medications appropriately. But once someone comes pregnant, and sometimes it's a surprise, and that's fine. The
Yep.
answer is not, you got to stop everything.
No, please don't. Oh my
And
gosh.
if you're listening to this, you don't have to stop
Mm-mm.
everything. What
No.
I recommend that you do is you call that hey, I'm a new OB. I'm on X, Y, and Z medications for my psychiatric, for my depression, anxiety. Do I need to come off of it? And if they
Right.
say, I don't know, then you say, I need a referral to somebody that does know so I can make a decision in a timely fashion. That doesn't mean 8 weeks down the road. That doesn't
Right.
mean 4 weeks down the road. That means like within a week, maybe 2 weeks. You need to
Right.
talk to somebody about your medications if your OB provider can't advise you on that. But the answer is
Absolutely.
not to stop everything, right?
No, please don't. Please don't, because
Yeah.
I'm thinking about a few clients that I've worked with that did become pregnant after being on medications, and that was the idea that they had, and they had some significant depressive
Yes.
episodes,
Yes.
and it's like, no, when we think about some of the hormonal changes that
Mm-hmm.
that women go through, so it actually it was really nice. Their OBs were very, very collaborative,
Yeah.
and worked with me as a team, and I could let them know
Yes.
this is what I'm seeing. This is where she's
Mm-hmm.
at, or they are at with their depressive episodes.
Mm-hmm.
And we kind of, I obviously deferred to the medical doctor to make that decision, but
Yes.
they really took my
Mm-hmm.
observations into account as well, because I saw this person weekly.
And
So
that's another red flag too.
yeah,
If
yeah,
your provider's not willing to talk to your mental health professional or
hmm,
your psychologist or psychiatrist, whoever's helping to manage your meds,
yeah,
I've called
hmm,
many
hmm,
docs to
hmm,
talk about it. I'm not
yeah,
above that, and
right,
and you got to make time to do that. They should be willing to do that as well.
yes,
It has to be
definitely,
collaborative. Okay.
yes,
What was the and the other point I want to make is, in pregnancy in general, and even when trying to conceive, your mental health and well-being, if it's not controlled and you come off those, it can be just as dangerous to a pregnancy
exactly,
as if you're on medications. So,
exactly.
I don't mean to say it's not the lesser of two evils. It's not. We
No,
have medications we have many medications that be given in pregnancy and while trying to conceive, and that are safe and effective, but you have to be healthy. Um,
exactly,
we wouldn't tell you to stop your diabetes meds, your chronic
right,
hypertension meds. So why would we tell you to stop your anxiety, depression, or anything else meds?
right,
The stigma
exactly.
has to stop. The stigma
It
has to
does.
stop. It needs to stop. Um, yeah, so this is just a comment about different things work for different people, and you
Yep.
can comment us on this too. You might find when you're starting this journey, and listen, it's not an easy step to take. It's
Hmm.
not. And I
Hmm.
want to say here, it's not a weakness that you're seeking out help from people
No.
like Dr. Lori or anybody else. It's not a weakness. It just means you're taking care of yourself.
Hmm.
You wouldn't find it a weakness if you're going to your endocrinologist or whoever. It's not a weakness going to someone that's going to help your mental health. So you might also find what you get in there that modality or that specialty might not work, and you might need to try a few things, right?
Exactly.
So try different
Exactly.
things. So what are your thoughts on that until you find the shoe that fits, right?
Absolutely. Just like,
Yeah.
I mean, just like there's so many different kind of therapy coaching programs, excuse me,
Yeah.
fertility coaching programs out there, and therapists or what have you.
Mm-hmm.
It's not one size fits all.
Yeah.
And, so it's really also identifying, what do you need more of in your journey? Do you need more emotional support? Do you need more support around, nutrition, things like that? Because I do see some people who have questions about, what should I be eating? And it's like, okay, well, that's what they're focusing on right now. So let's make sure you get that nutritional support to help
Yeah.
optimize your fertility.
Mm-hmm.
And even when you decide that you have to address your mental health issues more in depth, it's like, look at a few people
Yeah.
and,
Yeah.
and see, just see what and I always think the relationship is key. That's first and
Yes.
foremost. So, credentials aside, because you
Yeah.
can have people who've had,
Yes.
just adequate training,
Mm-hmm.
and say all the right things, but if it's not the best kind of fit
Yes.
relationally, then, the best interventions aren't going to work. So I think trusting your gut with that too.
Yeah, and it's okay
Hmm.
to shop. It's okay to shop around. It's okay to
Absolutely.
get second opinions and third opinions and so on.
Absolutely.
This is a good comment here. I think sometimes when you have your baby, you're forgotten. I think she was talking about once you, like the comment I made about going through, having that take home baby and you still have some trauma related to your journey getting there. And that's true. And I went through a little bit of that myself, from other people as well as me doing it to myself. So that is common. And it's not, and I don't know that I felt forgotten, but I felt like what my needs were maybe not as important anymore. Does that make sense?
It does, because, let's face it, so much attention, gets drawn to the baby, or the babies, and that can leave the mom feeling pretty isolated.
Yeah. What else do we have? Mass connection. Okay. Well, you're getting a lot of glowing remarks, Dr. Johnson.
Oh, thank you, guys. Thank you.
And so here's so the support groups might provide immediate, instant relief, but not address the underlying source of trauma.
Exactly.
Yeah. Yeah. That's a good point. Yeah. What else that we are praying? So this is a good comment. So how do we announce that we are pregnant to people who are going through infertility? Do you have a recommendation on that? Like if you have a friend that's going through infertility, but you become pregnant, what do you do?
That's such a great question, because I've been on the receiving end of that for several years. And so first of all, congratulations on your pregnancy. And I think it really depends on who you're telling and knowing that person. So if you know the person's been struggling for a while, what I might do, and I think what's been a little bit safer for people actually, has been emailing or texting. And I know that might not feel very personal. And being a Southern gal, where it's like, we like communication, and, this is one of those exceptions where I think writing a lovely note is just a nice way to share that information. And that way, what happens is the person who's been struggling gets a chance to process it. I think the hardest thing, and again, it's knowing your person. I just didn't appreciate being surprised with a baby bump at 5 months when we had been part of, this journey. And I just felt like, oh my gosh, like
nobody,
and I was so happy for her, but immediately I was still like really sad. And so I had that initial reaction where I couldn't stop crying. And, so I think just allowing that person, that space, and also knowing that they don't love you any less. They're not going to be supporting you because of that or what have you, but, just allowing them some privacy around that so that they can be more present.
I think for me, I had two really close friends that got pregnant when the other people were pregnant. Obviously, I deliver babies, but as far as like close friends that got pregnant while I was going through my journey, for infertility. And one of them called me and said, I just want you to know that I'm pregnant. I didn't see it on Facebook. I didn't have to hear about it on social media anywhere. She goes, I can tell you as much you want to know or as little. Just tell me what you need. And I respect it. She did call me, and that was okay with me. But I respected that because, I didn't really know what I needed. But she was willing to let me lead the way and not feel any type of way about it. But I also learned in my process, too, is that sometimes our friends don't know what to do, and they feel like it's a no-win situation, and they're like, well, she might get mad if I call, she might get mad if I text, she might get mad if I do. And we have to understand that about them too. And if they're really good friends, they're going to do their best to try to make it, but we can't hold them to such a high standard, because it's not easy, right? It's not easy.
It's not easy delivering the news. It's not delivering, so I think I just feel like let's just have some grace all the way around. Because it's hard. It's hard to tell. It's hard to be on the receiving end. So that's why I said just know your person who you want to tell. And then also try to honor what you might need too. In that. So
and it's okay. I think communication is key. If you just can't do it, just tell them that. And if they're a good friend to you, they're going to understand.
Yes. And your friendships can survive. I think this is just where I think like history and foundation and, all of that kind of plays into that. But, there might need to be a little bit of space just for processing, but, that space allows people to re-engage. So,
And it's tough. It's not easy. People ask me that question. I'm sure they ask you all the time too. And I wish I had a perfectly scripted, this is exactly what you need to do, and it's going to work every time.
Right.
It's not.
It's not going to work. No, I said, you know what? I love you. This is really hard for me. I just want to make sure that before, we announce it, this is what's happening. I know you might have some feelings about that. I want to give you some time to
Yeah.
express that. You
Yeah.
know, I'm here,
Yeah.
kind of
Yeah.
thing.
Yeah. Yeah. Yeah.
So, mhm.
Okay. So this one last question, and then we'll be done,
Okay.
because it's going to shut off. So, how can you deal with the ups and downs of infertility, keeping hope, but also not getting your hopes up because the disappointment is so hard? So yeah, I think
Yeah.
it's a fine line. Like,
Hmm.
you want to be hopeful, but you
Hmm.
don't want to be too hopeful.
Right.
And we don't know what makes me too
Oh,
hopeful, because
I know.
I don't want to get up here and then crash when it doesn't turn out.
Exactly.
Yeah,
Exactly.
that's another thing that it's hard to advise on, right?
It really is, because hope is what keeps us going,
Yeah.
keeps us going through this process too. I feel like, so I think you have to honor whatever it is that you do. Like some people are able to temper that as much as possible, but the reality is I think it's hard not to get your hopes up.
Mm-hmm.
But I think it's staying focused on everything that you've done within your power. And
Mm-hmm.
having a sense of resolution about that.
Mm-hmm.
So I think when people find a sense of power and like knowing, you know what, I've meditated all I can do. I've
Yeah.
journaled. I've done all of the things within my power of control. It's going to be what it's going to be.
Yeah.
That sense, that space tends to lend itself a little bit more to, kind of riding that wave, but it's still going
Mm-hmm.
to be a wave.
Yeah.
Yeah.
No, it is a wave. It's always
Hmm.
going to be that. There's always going to be ups and downs. You can't not have them
Right.
going with infertility and the aftermath of infertility.
Hmm.
It's always going to be ups and downs. You're always going to think I could have done more, or
Exactly.
I didn't do this, or you read about something new. I think the important thing is what I say when you're going through infertility journey, especially when you're going through infertility treatments.
Hmm.
You need to have a good relationship with your fertility
For
physician,
sure.
because you have to trust what they're telling you.
Hmm.
If you don't, and you feel yourself going to social media or friends, and you're thinking, well, why aren't they doing this for my treatments? And then that's just going to make it even worse for you.
You know what?
You really
I'm
have
so
to.
glad. Yes.
Yeah, go ahead.
Yeah, no, and that's actually one of the reasons, that's one of the questions I ask during a consult too, is
Yeah.
what is your relationship like with your doctor?
Yes.
Because if you're asking for coaching in particular, but you don't really like your doctor or feel like
Mm-hmm.
you're in, that actually is going to, I think, impact the
Yes.
work that we do too.
Absolutely. Yeah. Mm-hmm.
And, sometimes people don't want to hear that, but it's true.
Yeah, yeah.
So,
You got to trust them first and foremost,
hmm,
and know that whatever they're telling you to do, you you trust.
yeah,
Because if you are seeking stuff, and then I hear all this time, should I be doing this? And this person's doctor did this. You can't do that to yourself.
yeah,
It starts with you and that physician, and what they're prescribing for you, and what their treatment plan is, and you have to trust that. If you find yourself that you're not, then that might not be the person for you, and you
exactly.
need to find someone else, because that's going to not only impair the outcome, it's going to make your journey a lot more difficult, right?
Exactly,
Yeah.
exactly, exactly.
Yeah.
Definitely
Yeah.
makes your emotional journey harder.
Right, it does. Okay, so this is going to shut us off here in a second. Can you tell
Okay.
people how to find you?
Yes. So I am on Instagram mainly at Dr. Lori Johnson, and that's DrLoree, and Johnson, common spelling. I also, you can reach me through my website at drloriejohnson.com.
And I'll put all of our information in the caption of this video, so you can access it there. But thank you so much. This is really
Thank
helpful.
you. Thank you
Thank
so
you.
much.
I have been looking forward to talking to you. I think our first one I canceled because of something with work. And then I was scared to death that when
Yeah.
I was like, no, but we got through it. So
We
yay.
got through it. Yay.
Have a wonderful day. We'll talk
Thank
soon.
you. Okay. Take care.
Bye.
Bye-bye.